Let's talk about pelvic organ prolapse. So, what is pelvic organ prolapse? Pelvic organ prolapse is when our pelvic floor changes potentially, and there is a change in the range of movement of the tissues in our pelvic bowl. So, what that looks like potentially is a symptom of a heaviness or a dragging or a bulging. That is the most common symptom that women report with pelvic organ prolapse. And what is happening is the structures like the pelvic floor may have got some weakness in there, and that has led to a bulging of one of the pelvic organs into the vagina. So that might be an anterior vaginal wall prolapse where the bladder is pushing down into the vagina. That might be a uterine prolapse where the uterus is descending into the vagina, or that might be the posterior wall, so the bowel. It is one of those organs pushing onto the vaginal walls, so the wall has slightly bulged into the vagina there. And as I said, the main symptom is a heaviness, a dragging, or a bulging sensation. Now, this is a very common thing. But what I would say is it's just a change in the range of movement of tissues. The same way as we go through life, we might have a change in the range of movement of our skin. That might be a wrinkle. Or after we have breastfed babies, we might have a change in the range of movement of our breasts. And so this is the same. Our vagina as a woman goes through many changes, particularly childbirth, menopause, all of these things, and that can lead to a change in the range of movement of those tissues. We don't pathologize it when it is our breast tissue or our skin. So, when it comes to prolapse, what can we do? Often women are very scared, which is understandable, but we need to think about how we can help women to remain active despite these changes. The first thing I would say is when we look at the literature, so the scientific evidence, pelvic floor exercises are a really, really well researched intervention, almost a gold standard for pelvic organ prolapse. So I would go back to the pelvic floor basics video and watch that and start to integrate some pelvic floor exercises into your program. The next thing I would say is a lot of women are scared to do other exercise, running, lifting, functional fitness. What we need to think about is, do we have any evidence that these things actually make pelvic organ prolapse worse? And we have the contrary at the moment. We even have some evidence to support the fact that women who are stronger have less symptoms of pelvic organ prolapse. We have no literature that says that pelvic organ prolapse is made worse by running, i.e., the prolapse itself changes. Some women might report some increased symptoms, but that doesn't necessarily mean the prolapse itself has changed. So, really, we want to keep women active despite pelvic organ prolapse. The first thing I would say is one, we need to start tailored pelvic floor exercise. Two, we might want to regress or change exercise to reduce symptoms. We might want to think about breathing strategies. We might want to think about reducing the load. We might want to think about reducing the intensity of running whilst we're retraining our pelvic floor. But it is so important to understand that actually doing pelvic floor strengthening and continuing to exercise can be very important for a woman with a prolapse.